I try to really emphasize with the residents when I meet with them, especially as a group, is that I really think one of the strengths of this program is the culture of the residents, really how the residents do relate to each other. We really try to encourage residents to understand that resident culture is something that they are creating all the time with each other, on the basis of their interactions, their attitudes with each other, and that if they have a strong and collaborative resident culture, that's something that, as like the program leadership, we can't necessarily make that occur. That's something that has to come out of each individual. And each individual needs to take an intentioned approach to, well, how would I like to create the kind of resident culture that I'd like to be in? And I think that's something that the residents really have been doing a fantastic job with creating that. I mean, this current group that we have, I think, is one of the most active in terms of service, one of the most active in terms of social activities, one of the most active in terms of communication with each other. I think part of that is, by virtue of having big group text messages that are possible now that maybe weren't possible 10 years ago. So, I mean, there's a free flow of information and support going between the residents now that I think is really something to see. I think that the program is really strong in that regard at this time. And again, I think the residents deserve an incredible amount of credit for really for really doing the work around having this place be a place where people can feel supported and collegial. Another thing that's really important in terms of the kind of resident wellness and kind of resident culture piece of where I'm interested is that what I've definitely noticed over time is that while residency can be a challenging experience for people, and that when the group of residents, when the individual classes of residents function cohesively and collaboratively and sort of mutually altruistically with each other, everybody in that group tends to do better. And the groups of residents where people are getting excessively competitive with each other, or trying to avoid work, or things of this kind, where sort of the individual concerns are really overtaking how the group is functioning, everybody tends to struggle. So we really try to set up a situation where the groups of residents really enjoy each other and really sort of work to support each other actively. So one of the ways that we do that is we have tea groups that are a part of our residency wellness process, and they meet every 2 weeks, especially early on in the residency experience, and then later on they meet a little less frequently, but it is a longitudinal part of the whole residency experience, and that's a place where there's a faculty member or psychologist who's not as hooked in directly with the training process, who helps to facilitate this group process and guides the discussion in a way that ultimately, we hope is, productive and supportive.